Hi everyone, I'm Dr. Bisher, and this is
Dr. Sarah Ferrer-Brooker. Hi.
And we're your favorite dermatologist at Bold City Dermatology in St.
We're
Augustine,
your
Florida.
only dermatologist at Bold City Dermatology.
And we're your favorite dermatologist on YouTube, okay?
We're trying here.
Yes, we're trying very hard.
This is hard. You have to like, blah, 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 blah,
Yeah,
blah,
I know.
Golly.
So today, we're going to talk about the 5 concerning spots that we have to deliver bad news for. We're gonna start with the precancerous spot. Number 1 reason, this is very, very common.
All the time, people come in, we live in Florida, and somebody might come in with a sandpapery rough little patch on their forehead or their hands.
Or your nose.
Or your nose. It has more of a feel than it has a look. And this is what is called an actinic keratosis.
If you imagine how smooth a baby's butt is, for example, it's very smooth. What? A baby's butt is smooth. Or Dr. Ferrer's face is very smooth.
Yes.
But then when you if you close your eyes and rub your skin, you can feel these sandpapery projections off the skin. When you start feeling those, and sometimes they're painful, sometimes they're asymptomatic, meaning you don't feel like
Or it
anything.
might just be like a piece of dry skin that just won't budge.
Exactly. Those are precancerous lesions called actinic, meaning due to the sun, keratoses or keratosis for one, meaning growth.
Agreed.
How do we treat them?
There are many ways to treat actinic keratosis. If you just have a few of them, then liquid nitrogen's my go-to. It's a little spritz of very, very, very cold water.
Negative 313. It's not water, it's nitrogen.
That's what it feels like.
Yes,
You're right. It is liquid nitrogen.
Yes.
Is it really negative?
313 Fahrenheit.
Megan, fact check. I thought it was negative 196.
Celsius. Megan, don't fact check.
Oh, it's...
Because I know. Let's move on.
So we're both right?
Yes,
It's just
I'm
different.
always right,
Okay,
and she's
fine.
right as well. I'm gonna keep this in here. So we freeze them if there's just a couple.
Yes.
All right, and then if there's a lot of them, we can use like topical chemotherapy agents. We can use blue light treatments. If we're not sure if it's precancer or cancer, then we'll biopsy it sometimes.
Agreed.
If we have that gut feeling that it could have changed into something else, based on our clinical observation, then we go ahead and biopsy. And sometimes it can be hypertrophic, meaning thick. And sometimes if they pass the top layer of skin, if they go deeper, or if the whole top layer of skin is bad or atypical, then we call them a
Squamous cell carcinoma.
in situ, meaning it's superficial, invasive, meaning that it's deeper. Squamous cell carcinoma can happen in a lot of parts of your body. We're talking about skin squamous cell carcinomas. These usually happen obviously on the face in sun-exposed areas. They can happen on the lips. They can happen in the eyelids. They can happen in the genital area, not due to sun exposure. I'm sure sometimes people like to tan all over, but the genital area is due to HPV, which is a virus.
I think 9 times out of 10, it's a place like your forearm or your shin.
So from squamous cell carcinoma, we move on to its cousin, basal cell carcinoma, which is also mainly sun-related.
People usually come in and say they have a little pimple that bleeds in the shower or when they wash their face, or a new little growth that scabs.
A lot of times they're translucent or pink, and they also have these like vessels feeding them, so you can see that. Sometimes it can be mistaken for a scar. So if one day you find like this scar that you've never seen before, it may be a basal cell carcinoma, especially if you don't remember any trauma to the area.
Agreed. They can be kind of elusive sometimes and tricky.
And the squamous cells and the basal cells usually do not metastasize, go anywhere else in your body, especially if you treat them very fast and before they locally spread as well. So basal cell carcinomas, let's talk about pigmented lesions.
I'd love to.
Here we go. This is my best analogy. I always use this. Let's see if I can impress you. So moles are a spectrum.
Not impressed.
I didn't even start. So moles are a spectrum, right? You have your good citizen mole, which is a benign mole. And then you have the mild, moderate, and atypical mole, which is the unethical mole. So these are all still considered benign, but they are various degrees of being unethical. And then you have your melanoma, who's a criminal. So you don't want your neighbor to be unethical or highly unethical, because one day they can become dangerous or criminal. So that's why we remove these moderate or severe dysplastic or atypical moles because they haven't turned into melanoma yet, but they can turn into melanoma. Once it turns into melanoma, you have got to treat it because then it is cancerous and could go to other parts of your body, could be metastatic.
It's very difficult to tell the difference between a very atypical mole and a melanoma. Sometimes you don't know until you actually remove it.
Exactly. So the fifth one is?
Melanoma, probably one of the most serious skin cancers that exists. Unfortunately, we diagnose it every day. Luckily, we catch it extremely early.
Right. I mean, unless somebody has let it go and comes to us, and it's the cat's out of the bag at that point. Melanomas can also be very elusive because they can be non-pigmented, amelanotic, or they can be very benign appearing to the naked eye. Even for us, sometimes we biopsy lesions that come back as melanoma, and we're like, oh my God, I didn't think this would be a melanoma. So the A, B, C, D, E's of melanoma that we talked about
imperfect.
is imperfect. It'll catch, I'd say, probably 85% of melanomas with that, but there are some that are still elusive. If you have a family history of melanoma, if you've had a lot of sunburns, if you had a lot of sun exposure, please go to the dermatologist, at least get a baseline skin check, see where you're at. And if you've had a melanoma or previous skin cancer, your risk is even higher, so you should get at least biannual skin exams. Or if you've just had been diagnosed with a melanoma, usually we like to see you every 3 months because we don't want to miss it.
Most of the time we're able to clear you of this in one office visit.
So don't forget to go to your dermatologist if you have a changing mole, if you have a spot that is not healing, a spot that's bleeding.
Sandpapery dry spot.
Exactly. And don't forget to drop your comments below if you have any questions. But yeah, just come by, see our practice, say hi to us if you're in the area. Otherwise, please don't forget to like and subscribe, and thank you for joining us.
Bye.